is that so every year about 12,000 women are diagnosed with this cancer, and more than half of them die from it. About 8,000 of them die from it. The thing with cervical cancer is that they don't come to the hospital usually until it is too late. You know how we are now. Any funny you know, they know how they are. Any funny thing that they see coming out from there is infection, and so we keep on treating that. You know, irregular menstrual periods, bleeding, in between periods, all of those things. Like we do not diagnose on time, or rather, we do not go to the hospital. We properly diagnosed on time, and so usually when it is found, it's late. Now, cervical cancer is one of the few, if there's anything like that, what we call beta cancers, just because it has a stage that we call the precancerous stage. So that is when those cells, because what cancer simply is a change from normal to abnormal, from normal cells to abnormal cells. Now, in cervical cancer, when they begin to change, there is a stage where you can catch them before they have become what they have become. But so if it's a woman that is vigilant, that is screening, that is checking, you can quickly catch it at that stage.
What are the signs?
This is the question I want.
What are the signs?
So the signs are: one, from one menstrual period to another one, you realize that you're bleeding, what we call in between bleeds. Two, painful sexual intercourse. Three, bleeding after sexual intercourse. 4, lower abdominal pain, and I'm talking about severe pain that can start mild but becomes very severe. 5, it can be a funny discharge that just keeps on, it's just continuous, and then later on when it starts to spread, then you can have painful urination or even pain when you go to defecate. So these are some of the most common signs and symptoms.